Let's face it, we all have little things about us that we wish that we could change. And unfortunately, the older we get, the longer our list gets. So today, we thought we would invite some of our viewers in to talk candidly with our sponsor, Dr. Patty Flint, about some of the things on their list. Welcome, ladies, to the show.
Thank you.
All right, let's face it, right, Dr. Flint, when people come into their office, how long are their lists really?
Well, it depends, I think, a little bit on the age range, but for all of us, there's always something that we'd like to tune up if there's an opportunity.
Well, we thought that it would be fun just to get some of our viewers, our real-life viewers, people out there just like you, that have maybe thought about it but didn't really know sort of how to go about it or the questions. So we have Kathy and LaDonna over here. And Kathy, we'll go ahead and we'll start with you. Have you ever thought about plastic surgery?
Yes. Jowls.
Is that what they're called? The jowl lines?
Yeah. Our jawline does tend to respond to aging and gravity over time, and most patients are looking for something that's not surgical to begin with. I think when I look at someone's face and we talk about improving jawline characteristics, it's usually a multi-pronged approach. So I generally recommend fillers, which are injectable agents that we fill in the lines and creases that develop, and then at some point we're going to want to discuss repositioning that tissue that's starting to come down, because that used to live up in your mid-face. And there's really
It used to live way up here?
Yeah,
and it's relocated way down here?
I always say gravity is not our friend, but there certainly are remedies for that. And I think surgical repositioning is really probably the best option for recapturing that more angular, graceful jawline that we have in our 20s. But I think topical skincare can also play a role in preventing accelerated aging. So when I see patients and talk about facial rejuvenation, it's not always a recommendation for surgery. It's usually surgery, filler, and skincare to get the nicest results.
Is that what you recommend first, is surgery? Or would you go under the knife? Is it anything that you've ever thought of? Or?
Oh, absolutely. Yes.
I mean, you have beautiful skin.
Thank you.
My mother had something done many years ago, and I swore I would never have anything done.
How long ago was
But
that?
guess what? I reached an age where...
Yes, you're rethinking that.
I am.
I think some of the techniques that were used decades ago certainly are no longer used. And I think my practice has always focused on creating a natural appearance. In fact, I say if I can't make it look natural, I'm not going to do it. So a focus on repositioning tissues into an area where they started, not into an area where they've never lived, will allow you to enjoy just a natural, refreshed appearance without ever having to look stretched or tight after a facial rejuvenation procedure.
LaDonna, what have you thought of? I mean, you have beautiful skin as well.
Thank you. Well, when I look in the mirror, the first thing I see are lipstick lines. And for young people, you don't know what lipstick lines are. As you get older, you get these deep lines that the lipstick just runs right up it, and it's horrid. And then all the lines around it just drives me absolutely crazy.
Well, you said gravity is not our friend.
Gravity is not our friend. Well, I think, once again, it's a multi-pronged approach. It's never too late to start on a doctor-prescribed skincare program to help rejuvenate some of the collagen that you've lost that's leading to that wrinkling. Vertical lip lines are one of the most common complaints in my office in those of us who are 40 and up. They're difficult to treat. I'm not going to mollycoddle it, but the trick is both to use filler, topical skincare, and peels. We can do a TCA peel in that area and really soften those lines. And I think with that approach, you don't have to give up on wearing lipstick comfortably.
Where would you start, like for someone like LaDonna that maybe is not ready to go under the knife?
Right.
Obviously, the topical skin
routine.
You know,
I think each patient, you have to assess what their goals are. And, you know, some patients come in saying...
her age.
You want to look my age? I love you.
We always want to know what your goals are. It really doesn't matter exactly what I think would be best for you. It's what your goals are. But I do try to suggest skincare to all patients in all age ranges, because I know not only is it therapeutic when aging changes already exist, but it's preventative for younger patients. So skincare has to be the backbone of anybody's plan to remain youthful in appearance. And then fillers can be a nice stopgap before surgery as we're warming up to the idea. And then I think if there's gravitational change, it's time to really start to consider surgery and discuss the options in that regard.
Well, Dr. Patty Flint, thank you very much
Thank
for coming
you,
on the
Andy.
show. And
It's a pleasure.
think it's nice when you see someone like Dr. Patty Flint and she has beautiful skin. So
Thank you.
it definitely helps when trying to choose, obviously, and she has all the qualifications as well. Thank you,
Thanks,
Kathy
Andy.
LaDonna. Thank you very
Thanks,
much.
ladies.
Well, all of the information is on the screen. You can see her address there, 7301 East 2nd Street in Scottsdale. And she also has an office in Mesa, 1520 South Dobson Road, and that's Suite 218. And then you can also find Dr. Patty Flint at pattyflintmd.com and the number 877-91-FLINT.